All right, diving in today, getting way down deep into the systems you don't always think about but are absolutely crucial. We're talking about the peripheral vascular system and the lymphatic system.
Yeah, these systems are really the unsung heroes, keeping everything moving, keeping everything clean.
So think of this as like getting a backstage pass, going behind the scenes to really understand how these networks function, why they are so vital for your health, and also what can go wrong.
That's right. And most importantly, what can we do to keep these systems in tip-top shape? It's really all about maintaining that delicate balance, making sure everything is flowing as it should.
So we've gathered, quite a bit of information here, research, different perspectives to try to really give you a comprehensive view of these systems.
Right. We'll be looking at everything from how these systems deliver oxygen and nutrients to every single cell in your body, to how they efficiently whisk away the waste products we don't need.
And we'll even delve into the lymphatic system's role in your immune system. That's a big one.
Yeah, it's a fascinating system, very intricate, but so critical for overall health.
Okay, so let's start with the basics. When we talk about the vascular system, what exactly are we talking about?
So essentially, the vascular system is your body's delivery and waste removal service. It's like this intricate network of highways and byways, constantly on the move, transporting vital cargo.
Okay, so it's like the circulatory system.
Exactly. And within this system, you have two key players. You've got your arteries and your veins. They have distinct roles and really make this whole transportation system work.
Right, so arteries, those are the ones that carry the oxygen-rich blood, right?
Precisely. Arteries are like the high-speed expressways, pumping oxygenated blood away from the heart to all the tissues and organs in your body. They're under high pressure to keep that blood flowing efficiently.
So they're kind of like the delivery trucks bringing the good stuff.
Yeah, exactly. And then you have the veins.
Those are the ones bringing the deoxygenated blood back to the heart, right?
That's right. Think of the veins as the more relaxed back roads. They carry the deoxygenated blood back to the heart to be replenished with oxygen. They're a lower pressure system than the arteries.
That makes sense. But how does the blood in the veins actually flow back to the heart, especially from the legs, going against gravity?
Yeah, that's a great question. Veins have these really clever mechanisms to keep that blood moving in the right direction. One of the key players here is your muscles.
Muscles. How do muscles help with blood flow?
Well, when your muscles contract, particularly in your legs and calves, they actually squeeze the veins, helping to propel the blood upwards. This is often referred to as the calf pump or even the peripheral heart.
So every time you move your legs, you're actually helping your circulation.
Precisely.
Mm.
And in addition to muscle contractions, your breathing also creates a pressure gradient that helps to draw blood upwards towards the heart.
Oh, so it's all connected.
Absolutely. And then there's these little one-way valves inside the veins. These valves prevent blood from flowing backwards. They make sure it only goes one way, back to the heart.
Like little traffic cops in the veins.
Exactly. So you've got these multiple mechanisms all working together to make sure that blood returns to the heart, even against gravity. It's a pretty remarkable system.
So it sounds like keeping our muscles active is super important for healthy circulation.
It definitely plays a key role, especially for the veins.
Mm.
Now, something I found interesting is that there are actually more veins in the body than arteries, and they're closer to the surface.
More veins. Why would that be?
Well, if you think about it, the veins are like the drainage system. They're responsible for collecting the deoxygenated blood from every nook and cranny of your body. So it makes sense that there'd be more of them to efficiently gather all that blood and bring it back to the heart.
It's kind of like having a more extensive network of smaller roads to feed into the main highway.
Exactly. Now, thinking about these systems and keeping them healthy, how do healthcare professionals actually check if everything is working as it should? What do they look for?
That's a good question. I mean, you can't exactly see your veins and arteries.
Right. Well, doctors use a combination of methods to assess the health of the peripheral vascular system.
Like what?
Well, first, there's visual inspection. They'll look at the color of your skin, checking to make sure it's consistent and appropriate for your ethnicity. They're also looking for any signs of abnormalities, like ulcers, lesions, varicose veins, or swelling. Anything that might indicate a problem with blood flow.
So they're checking for any visual clues.
Exactly. And then there's palpation, which is basically feeling with their hands. They'll check to see if your skin is warm and dry. They'll also assess something called capillary refill time.
Capillary refill time, what's that?
So you know how if you press on your fingernail, it turns white for a second and then the color comes back?
Yeah, I've seen that.
Well, that's capillary refill. It's a measure of how quickly blood returns to the capillaries after being squeezed out. In a healthy person, it should take less than 2 seconds.
So that's a quick way to check if blood is circulating properly in the smaller vessels.
Exactly. And they'll also feel along the veins to check for any tenderness or hardening, which could be a sign of inflammation or a clot.
Okay, makes sense. What about those lymph nodes you mentioned earlier? Do they check those too?
Yes, they'll palpate the lymph nodes, particularly in areas like the neck, armpits, and groin. Lymph nodes are usually small and difficult to feel, but if they're enlarged or tender, it can be a sign that your immune system is actively fighting something off.
Oh, so it's like a little alarm bell that something is going on.
Exactly, and of course they check your pulses.
Pulses, right, like at your wrist or neck.
Yeah, and in other locations too, like the feet and behind the knees, they're assessing the strength and rhythm of the pulses to make sure blood is flowing properly to those areas. Ideally, the pulses should be strong and equal on both sides of the body.
So they're basically taking your blood's pulse.
You could say that. And finally, they might use a stethoscope to listen to the sounds of your blood flow, particularly in larger arteries like the carotid arteries in the neck.
What are they listening for?
They're listening for any unusual sounds called bruits. These can be like swishing or whooshing sounds that might indicate turbulent blood flow.
So smooth and quiet is what you want.
Exactly. It suggests that blood is flowing freely without any obstructions.
This is all really interesting. So we've covered how these systems work and how doctors assess their health. But what about us? What can we do to keep these systems functioning well?
There are definitely things you can do to promote good vascular and lymphatic health.
Like what?
Well, exercise is huge. Regular physical activity helps improve circulation and strengthens the heart. Aiming for at least 150 minutes of moderate intensity exercise a week is a good goal.
Okay, 150 minutes. That sounds doable.
Right, and then there's the obvious one, no smoking. Smoking damages blood vessels and significantly increases your risk of developing circulatory problems.
I think everyone knows that smoking is bad for you.
True, but it's always worth repeating. And maintaining a healthy weight is crucial too. Excess weight puts extra strain on the heart and blood vessels, making it harder for them to function properly.
So eating a balanced diet and managing your weight can go a long way.
It definitely can. And it's not just about what you do. There are also factors beyond your control that can influence your vascular health.
Like what?
Genetics plays a role. For example, certain ethnic groups, like Black Americans, have a higher risk of developing peripheral artery disease, or PAD. There are also certain medical conditions, like diabetes and hypertension, that can damage blood vessels over time.
So it's important to be aware of any family history or existing medical conditions that might increase your risk.
Absolutely. Now let's talk about a specific condition that can affect the veins. Venous stasis.
Venous stasis. What is that exactly?
Basically, it's when blood flow in the veins slows down, or pools, usually in the legs. This can happen for various reasons, like prolonged sitting or standing, weak vein valves, or even pregnancy.
So basically, the blood isn't circulating efficiently.
Right, and this can lead to a variety of problems. You might see varicose veins, which are those enlarged, twisted veins close to the surface of the skin. You might also experience swelling in the legs and ankles, especially towards the end of the day.
That sounds uncomfortable.
It can be. And if left untreated, venous stasis can lead to more serious complications like skin discoloration, ulcers, and even blood clots.
Blood clots. That sounds scary.
It is serious, but the good news is that venous stasis can often be managed effectively.
So what can you do to manage it?
Compression stockings are often recommended. These stockings provide gentle pressure that helps to improve blood flow in the legs. Elevating your legs when you can, even for short periods, can also help. And of course, staying active and moving your legs regularly is key.
So even simple things like taking a walk or doing some stretches can make a difference.
Absolutely. Now, speaking of checking for problems in the vascular system, there's a really useful tool called a Doppler ultrasound probe.
A Doppler ultrasound probe. What does that do?
It's a non-invasive device that uses sound waves to measure blood flow in the vessels. It's particularly useful for detecting weak pulses or areas of reduced blood flow, especially in the legs and feet.
So it's kind of like a sonar for your blood vessels.
That's a good analogy. It helps doctors visualize the blood flow and identify any potential blockages or narrowings in the arteries and veins.
Fascinating. Now, shifting gears a bit, let's talk about the lymphatic system. You mentioned it earlier. It's separate from the vascular system, right?
That's right. It's a completely distinct system, but it works in close collaboration with the vascular system to maintain overall health.
Okay, so what exactly does the lymphatic system do?
Think of it as the body's cleanup crew and security force all rolled into one. It has several key functions. Firstly, it helps to maintain fluid balance in the body.
Fluid balance. How so?
Well, you know how some fluid leaks out of the capillaries into the surrounding tissues? The lymphatic system acts like a drainage system, collecting that excess fluid and returning it to the bloodstream. This prevents fluid buildup and swelling in the tissues.
So it's like a recycling system for fluids.
Exactly. And perhaps even more importantly, the lymphatic system plays a crucial role in immunity.
Immunity, right. I knew it was involved in that somehow.
It is. It's a key player in defending the body against infections. The lymphatic system contains these small, bean-shaped organs called lymph nodes. You have them all over your body.
I've heard of lymph nodes, but I don't really understand what they do.
Lymph nodes are like little filters. They trap bacteria, viruses, and other harmful substances that enter the body. Inside the lymph nodes, you have specialized immune cells that attack and destroy these invaders.
So the lymph nodes are like little battlegrounds where the immune system fights off infections.
That's a great way to put it. And finally, the lymphatic system also plays a role in absorbing fats from the digestive system.
Fats.
Yep. Specialized lymphatic vessels in the small intestine absorb dietary fats and transport them to the bloodstream.
Wow, so it's a multitasking system. Fluid balance, immunity, and fat absorption. That's impressive.
It really is. And just like the vascular system, the lymphatic system can be affected by certain conditions. One that's important to be aware of is deep vein thrombosis, or DVT.
DVT, I've heard of that. It's a blood clot in the legs, right?
That's right. DVT occurs when a blood clot forms in a deep vein, usually in the legs. This clot can block blood flow, causing pain, swelling, and redness in the affected area.
And I think you mentioned this earlier, but DVT can be really dangerous, right?
It can be. If the clot breaks loose and travels to the lungs, it can cause a pulmonary embolism, which is a life-threatening condition.
So it's important to recognize the signs of DVT and seek medical attention immediately if you suspect you might have it.
Absolutely. Some things that might increase your risk of DVT are prolonged immobility, like during a long flight or bed rest, surgery, certain medical conditions, and even some medications.
So staying active and moving around is important for preventing DVT as well.
Definitely. And if you do have any risk factors, it's important to talk to your doctor about ways to reduce your risk.
This has been a fascinating deep dive into these two vital systems. I've learned so much about how they work and what we can do to keep them healthy.
Me too. I think it's really important to appreciate these systems because they work tirelessly behind the scenes to keep our bodies functioning properly.
Absolutely. And I think our listeners will walk away from this with a much better understanding of the importance of taking care of their vascular and lymphatic health.
I hope so. Knowledge is power when it comes to our health.
So before we wrap up, any final thoughts you want to leave our listeners with?
Sure. I think it's important to remember that even small changes in your daily habits can make a big difference in the long run. Things like staying active, maintaining a healthy weight, and not smoking can go a long way in preventing problems with these systems.
Great advice, and for our listeners, we'd love to hear your thoughts. Knowing what we know now about the calf pump mechanism, think about this. What are some simple actions someone with a sedentary lifestyle could incorporate into their day to support their circulation without even needing dedicated exercise time? Let us know your ideas. Until next time, keep exploring.